Good morning. My name is Trisha Mitchell. I'm your invigilator for the OET speaking test, conducting on the 29th of January 2021. Can you say your name for the record, please?
Good morning, Trisha. My name is Eugene Reeves.
And what is your candidate number, please?
My candidate number is 212842430.
Thank you. And you are taking this test as a nurse? Is that correct?
Correct.
Thank you. Can I see your ID, please?
Sure.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Do you have any career goals?
5 years from now, I aim to complete a postgraduate degree in oncology nursing. I will spend the next 2 years mastering all the skills of being an onco nurse. I will get additional certifications and possibly pursue a master's degree in a university to further my knowledge and skills on the job.
What specifically brought you to oncology?
It's the mission and vision of the hospital that brought me here. It's a very unique environment and philosophy. We treat the whole patient, and it's all about healing. I felt like it was a place where I could really make a difference. Many of our patients don't just come here once. They come for surgery, and then they return for chemotherapy, radiation and other treatments. They get to know the staff members well. We deal with death and dying every day, but patients also live much longer now than they used to.
How do you feel about technology's impact on nursing?
Technology has revolutionized nursing. From order entry to intraoperative charting, every piece of equipment has a computer, and everything we do involves them these days. The challenge is training, and then keeping the workforce up to speed, in an ever-changing environment. We're moving forward every day with new innovations, that I feel, that we've embraced.
What are your recommendations for a nurse interested in oncology?
Find someone that you can shadow, so that you can experience the role in order to see what it entails. It's an exciting, innovative, and different kind of nursing that is very technologically based, yet patient-focused. Just explore the realities of surgical oncology nursing and see if it's for you.
What's special about where you work?
We perform many very complex surgical procedures that aren't routinely done in the community hospital because our surgeons are solely focused on cancer. Many of our cases involve 2 or 3 surgeons and last from 10 to 16 hours. We also have 4 Da Vinci robots that are in use every day. We received our first robot 6 or 7 years ago and have become one of the busiest hospitals in the country in terms of robotic surgery.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start the role play. Don't worry if I stop when the time is up.
Good morning. I am Eugene Reeves, one of the registered nurses working in this unit. How may I help you?
Hi, good morning, nurse. My name is Trisha Mitchell. Well, I have a considerable concern that is haunting me.
Oh. Is it okay to vent what exactly your concern is? We are here to help you.
I found some abnormalities in one of my body parts.
Oh. I see. Could you please explain to me in detail?
Yes, but... you know,
Are you embarrassed to express your situation?
yes. But, the thing is... well, my mother and aunt died of breast cancer. Now, I found some abnormal changes in me as well.
Okay, I realize your embarrassment. But, doctors and nurses are used to a huge range of medical issues, and these are some of the quite common conditions.
I understand that. But, I'm really upset, as I noticed the changes.
Alright, before proceeding further, shall I ask you a couple of questions?
Sure.
Could you please explain to me about when and what changes that you have noticed?
Well, I noticed a bump 4 months ago, and found it a bit hard.
I see. Lump in the breast are majorly of two types, non-cancerous and cancerous. For my better clarification, may I know, is it painful?
No. It is not painful. It's just hard. That's it.
Do you have ever found any discharges from the nipples?
Yes. I think I found discharge twice.
If you don't mind, shall I assess your breast?
All right. Yes. You may please.
Okay, now I can schedule an appointment with our doctor, so that she may ask you to undergo a procedure called mammography, for further confirmation of your condition. Is it okay for you?
Okay. But in your experience, what it might be?
I am really sorry to inform you that I am not the right person to talk about the diagnosis. However, I can assure you that there are different treatment plans available for your condition.
Is it something to be critical? I'm afraid of dying, and leaving 3 kids, all aged below 15.
No, please don't worry much. As I mentioned before, there are many treatment options available.
Okay. But, if it is too late to diagnose, it will be a worst situation. Isn't it?
On my assessment, your lump is not too big in size, and it is better not to delay anymore.
All right. So what you insist on doing first?
Kindly consult the doctor and undergo mammography for a perfect finding.
Okay, before that, could you please explain to me what mammography is?
Sure, I am glad to explain it to you. A mammogram is an X-ray of the breast. Mammograms are commonly used to screen for breast cancer. If an abnormality is detected on a screening mammogram, your doctor may recommend a diagnostic mammogram to further evaluate that abnormality. Am I clear to you?
Oh, is it an X-ray? So nothing to be worried about the pain?
No, it is not painful, and also it consumes only less time.
If the test result says it is cancer, what would be the next step?
Once your doctor has diagnosed your breast cancer, she works to establish the extent, stage of your cancer. Your cancer stage helps determine your prognosis and the best treatment options.
Stages? Could you please explain the stages? And also, how are the stages determined?
Breast cancer stages range from 0 to 4, with 0 indicating cancer that is non-invasive, or contained within the milk ducts. Stage 4 breast cancer, also called metastatic breast cancer, indicates cancer that has spread to other areas of the body. There are different tests such as blood tests, mammograms of the other breast to look for signs of cancer, breast MRI, bone scan, computerized tomography scan, positron emission tomography scan, which can rule out the stages of breast cancer. Are you getting my points?
Yes, I got it. Thank you for your time. Well, do I need to undergo all these tests?
Not really. Your doctor selects the appropriate tests based on your specific circumstances and taking into account new symptoms you may be experiencing.
All right. May I know the possible treatments available?
Yes, I can explain it to you. First, your doctor determines your breast cancer treatment options based on your type of breast cancer, its stage, grade, size, and whether the cancer cells are sensitive to hormones. Also, the doctor considers your overall health and your own preferences before starting the treatment.
Oh. Is it? That's great.
From my experience, most women with breast cancer undergo surgery, and may also receive additional treatment after surgery, such as chemotherapy, which uses drugs to destroy fast-growing cells. Hormone therapy, to treat breast cancers that are sensitive to hormones. Or, radiation therapy, to kill cancer cells by the use of high-powered beams of energy, such as X-rays and protons. Chemotherapy might also be used before surgery in certain situations. And also, there are many other treatment options available according to the need of the situation.
That is good to hear. Now, I have a great relief. So, I have the hope of survival.
Great. Also, strong willpower is an integral element for faster recovery.
Okay. Your words bring a ray of hope to me.
Good to hear that. Do you have any other questions to be clarified?
No, I am perfect.
All right, shall I book an appointment with our doctor now?
Sure, you may proceed, please.
Okay, it has been booked. You can consult the doctor in the next 10 minutes.
Thank you.
You are welcome.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.